Hello friends, welcome back to my channel Medicine of 101. Today we'll talk about neonatal sepsis from the aspect of pediatrics. Okay. So before starting the topic, let's know the what do we mean by sepsis. Sepsis means whenever we'll see any kind of the bacterial, whenever we see any kind of systemic bacterial infections, that is regarded as sepsis. So whenever we'll see any kind of systemic bacterial infection, that is regarded as sepsis. Now whenever we'll see this type of the problem at the neonate level, so we can consider that is what neonatal sepsis. So let's write it over here. So any systemic bacterial infection at neonate level in newborn, that will be regarded as neonatal sepsis. Okay. Now see, you can classify their neonatal sepsis in the two parts. I mean, in terms of the early onset neonatal sepsis and late onset neonatal sepsis. So I'm just classifying neonatal sepsis in the two parts. One will get over here, another I'm writing over here. So first thing first, we will get the early onset neonatal sepsis. NS I'm writing neonatal sepsis, and we will get another on the late onset neonatal sepsis. Now try to understand from here. Early means we will get what the first in the infections, and this type of the early onset neonatal sepsis we get within the 72 hours, within 72 hours after delivery. Okay, within the newborn. So in this cases, basically you will see the what type of the source of organisms. In this cases, basically within the 72 hours, the organisms they are supposed to be from where? They are supposed to be from the maternal genital tract. Okay, so the organisms from where will get the organism from here maternal genital tract. Genital tract. And the most common organisms, what are the organisms will get over here? We will get, for example, group B streptococci. Okay, then we can get E. coli in these cases. Okay. Now we need to know that what are the problems, the risk factors we can get in the early onset neonatal sepsis and in terms of the late onset neonatal sepsis. Now see, if we just say in terms of the neonatal sepsis, in terms of the late onset, in these cases we will get the organisms. Okay. Organisms, they will be acquired. They will be acquired from environment. From environment. Now, if it's environment, then it can be transmitted from the community. It can be transmitted from the hospitals. Okay. So if you say from here, from the community, you can get from the community whatever the organisms, and you can get from also the, okay, let me show here, from the hospitals in terms of the source of organism. In this case, let me use this one. Okay. From the community, whatever the organisms will get, we can get the Staph aureus, get the E. coli. Okay. And from the hospitals, the most important, and from hospitals we can get Acinetobacter, we can get Klebsiella. Okay, this type of organisms you can get. Now we'll talk about the risk factors in these cases. Okay, what are the risk factors we will see? So we will divide the risk factor in the three level. What type of the risk factors we'll see as far as the mother is concerned? So maternal risk factors. We'll talk about during the delivery risk factors. We'll talk about the neonatal risk factors. Okay. So first we'll talk about maternal risk factors. So when you are talking over here, risk factors, we'll talk about first the maternal risk factors. Okay. Within the maternal risk factors, we'll get the fever. You get the fever in these cases. The next one we can get over here, the problem that is premature rupture of membrane. That will lead to the bleeding in this case, so there will be much more complications in these cases. So let me use this one. And another one will get foul smelling liquor. Will get foul smelling liquor. In this case, okay. So basically we will see where within the membrane within the, in this case will go within the amnion membrane. We'll get the inflammations over here in this cases, okay. Now we'll talk about whatever the problem we'll see as during the delivery. During delivery, the complications may be seen also. Now during delivery, we can see in this case that there will be difficulty within the delivery, or we can say the prolonged labor. You can see the prolonged labor. Now we'll talk about whatever the problem we'll see in terms of the what neonates. In the neonates, we'll see there may be what the premature baby. In these cases, we can get the first thing. The second thing, we can get the low birth weight. Okay, let me write it over here. Low birth weight. This type of the risk factors will as far as the neonate level is concerned over here. Okay. Now, what type of the risk factors will get over here in terms of the late onset? Basically, we will see over here the risk factors. For example, I am just talking in terms of the neonates. So here we will see there is a chances in the what? Lack of feeding. So the feeding nature that will be lost. Okay, so the individuals or the neonates, they would not like to they would not like to eat anything just like this type of problem, or the breastfeeding. If we just talk about over here, so that type of the problem we'll see, or we can say the superficial infection. In these cases, we can get also the superficial infections. This type of the problem we'll see. Okay. Now there are some important questions as far as the MCQ is concerned from here. So whatever the questions they can ask in the exam. For example, they can ask, these are the what risk factors we are getting. These are the causative organisms and the source of organisms we are getting. So one important question is, what is the most important, okay, what is the most useful way to prevent the neonatal sepsis? So we can write over here the most important way to prevent sepsis. In these cases, we will get whatever the thing that is what. It's a very simple thing. There's the what hand washings. So before going to the ICU, here we need to do the hand washing. Hand washing at least for 2 minutes. For 2 minutes. The next of the questions they can ask that which of the following organism is the most common organism. So if we say the most common organism that can cause the neonatal sepsis. The most common organisms. So let's write it over here. The most common organism, that will be what? That will be the Acinetobacter first, then followed by Klebsiella. Is the thing. Now if the question is asked that the most common organisms, as far as the hospital is concerned, okay, within the hospital, whatever the most common organism will get, E. coli. Okay, within the hospital. If the question is asked the most common organisms throughout the world, normally throughout the world, then definitely it will be group B, Streptococcus. Don't forget this thing. Okay, the most common organisms in general, if they ask, they will be Acinetobacter and followed by the Klebsiella. If they ask the most common organisms as far as the hospital is concerned, that will be E. coli. And the most common organisms throughout the world normally, that will be what? Group B, Streptococci. Okay. Now we'll talk about the clinical manifestations. What are the clinical manifestations we'll get over here in these cases? Let's talk about them first. So we'll talk about now the clinical manifestations. Let's write it over here. So the clinical manifestations, whatever the clinical manifestations we'll get over here in these cases, the earliest clinical manifestations in these cases we'll get, okay, the poor feeding. That means the neonates, they would not like to feed, they get feeded over here, okay. So or you can say the alterations in the feeding. That means, for example, before getting infected, the individuals or the neonates, they used to just have the food, it's enough food, we can say in terms of the enough amount. But whenever they got infected, after that we are just seeing that what the alterations in the feeding. That means the alteration in feeding means whatever the food they could eat before, the same amount of the food they will not be able to eat, or they would not like to intend to eat. They would not like to intend to eat the food, same amount of the food in the next phase after getting infections. So we'll get over here the alterations in feeding. In this cases we can get over here. Now different types of the problem. For example, whenever we are talking that as far as the system is concerned over here, we can say whenever we are talking in terms of the respiratory system, whatever the problem we can see over here. At the level of the respiratory system, we will get hypoxia. You can get the hypoxia, you can get the dyspnea, we can get the tachypnea. Okay. Now, as far as the respiratory system is concerned, we already got it over here. So, whenever it is about central nervous system, whatever the problem we will get over here. In these cases, we will get shrill crying. Okay. We can get also irritability, irritations will get. And we can get also the seizures as well. Okay, as far as the CNS system, that means central nervous system is concerned, then whatever the problem we will see as far as the GIT system is concerned here, we'll get whatever the problem, we'll get feed intolerance, over here. We'll get the feed intolerance. We can get it also along with that, we can get the acidosis over here. We can get also the acidosis. So this type of the problem we can see. Okay. Now another important one over here, let me use this one over here. About the temperature, yes, the most important one. We'll get out the body temperature is concerned. So in this cases, if we see as far as the temperature is concerned, whatever the problem we'll see in this cases, we will get hypothermia. It will be more than the fever. So the hypothermia, that will be more common with respect to the fever over here. Okay. And if we see some severe infections, for example, if we see the severe sepsis, whatever the problem we can see over here, whenever we will get severe sepsis, that will lead to the what? Septic shock. Okay, this type of the problem. So if you see the severe sepsis, whatever the problem we will get over here in these cases, we will get for the septic shock. We can get the septic shock over here. We can get the multiple organ dysfunction. You can also get generalized non-feeding edema. You can get also generalized non-feeding edema. In these cases, we can get also just like these things. So these are the what clinical manifestations is. Okay, as far as the clinical manifestation is concerned, we'll get this type of the problems. Now we'll go through the diagnosis. So whatever the thing in diagnosis we can do, we'll talk about that thing. So let's know about the diagnosis. So when you're talking in terms of the diagnosis, then we'll go to the treatment. Okay. We can do the two types of the test. In terms of the diagnosis, we can do one is known as definitive test. Another you can do over here that is known as screening test. Okay, first let's talk about the definitive test. So within the definitive test, we have to take the blood cultures. After that, we need to find out what are the organisms, what are the problem we're getting over there. So in these cases, we need to take the blood, we need to take the blood samples, and we need to do the culture. But see, when we were just talking in terms of the blood cultures, to get the report, it will take time. So it's time consuming. So after getting the reports, just antibiotics will be prescribed, it will take time. So another test for that thing, we can just do the screening test. You can do the screening test over here. Okay. Now within the screening test, there are 5 components. In these cases, we need to do the 5 tests over here. What are they? They are the first. We have to count the total leukocyte count. We have to do a total leukocyte count over here. Then we have to do absolute neutrophil count. Then you have to do immature. Okay. Okay, let me write it over here. Its ratio. Immature is to total, total neutrophil. So let's write it over here. Immature neutrophil is to total neutrophil. These are tests. And you have to do also the micro ESR, sedimentation rate, we have to do also, and we have to do in terms of the C-reactive protein. Basically, we know whenever we get the C-reactive protein, whenever for any kind of the inflammations or infections, the what from the liver we get secretions of what? We will get the secretions of C-reactive proteins. Okay, from here we will get the C-reactive protein. Okay, now definitely there are some values. If we get it over less than, for example, 5000 per millimeter cube of the blood over here, if we get it less than 1800, if we get it over less than 0.3 over here, and if we get less than, okay, it will be more than 50 mm. And C-reactive protein, if we get more than 1 gram per dl, then we can consider this type of problem. Now within the screening test, if we get any 2 of the 5, if we just get positive any 2 of the 5, that will be regarded as the positive screening test. So any 2 of 5, if we get any 2 of 5, then it will be regarded as positive, screening test positive. Okay, or you can say screen sepsis. Screen sepsis, that is positive. Now we can do some other supportive test. If you want to do, we can do over here some other supportive test. What type of supportive test we can do over here? We'll do the test to maintain, we will see the blood glucose level is normal or not. We can just do the test for, we can do some just checks, X-ray we can do, and we can just study, or we can just see the CSF, cerebrospinal fluid, because one thing we'll get in terms of the late onset. Okay, let me write it over here. In terms of the late onset, okay, neonatal sepsis, in these cases there is a chances of having infections of meningitis. Meningitis. Okay. Oh, let me write it clearly. Sorry for spelling mistakes. Meningitis. Yes. So in terms of the late onset neonatal sepsis, we can get the meningitis. Okay. So for that thing, in terms of the supportive test, we can do also study of the CSF in these cases. So in terms of the supportive test, we can do the glucose. We have to check whether the glucose level is normal. We can do the chest X-ray. We can do the CSF test also. Okay. These are the supportive tests. Now we'll talk about the treatment. Okay. Whenever we are getting this type of the problem, what type of the treatment we should use in these cases, we'll talk about the treatment. Now let's talk about the treatment. Okay. So diagnosis is done. Now we'll talk about treatment. Okay, so let's start it about diagnosis. Okay. Now in terms of the treatment, the first, so in terms of the treatment, what can you do? There are some primary treatment. Okay, whenever we'll get an idea of the neonates in the hospitals, first primary treatment, we can write it over here in terms of, so nursery. Okay, let me write using this one. Okay, we can write it over here. First we need to do the supportive care. Within the supportive care, we have to make sure the some factors. Okay, we have to see whether the blood glucose level is normal or not. We have to see the temperature that is normal or not over here. Okay, we have to make sure these things. Along with that, we have to see in these cases or the neonates in these individuals over here. Yes, we have to use the intravenous fluid, and along with that we can use the intravenous fluid. So we have to see that whether glucose level is normal or not, temperature normal or not. We can also use the intravenous fluid in these cases. Okay, intravenous fluid. But then we have to do definitely the nursing, proper nursing. Now, whenever we are just suspecting that any individual can have the neonatal, the early onset or the late onset sepsis, before that we have to use the antibiotic therapy. In these cases, we have to use the starting the antibiotic therapy. Now, when you are talking in terms of the antibiotic therapy, because until you are not getting the reports, you are not getting any of the result from the reports, so you have to start the antibiotic therapy. In this case, in terms of the antibiotic therapy, you have to use the broad spectrum antibiotic therapy. So you will use the broad spectrum antibiotics. Okay, and in terms of these things, we have to give what? We have to use intravenous ampicillin, plus gentamicin. You have to use what? Intravenous ampicillin plus gentamicin in these cases. Okay, but if we see there is a chances for having the meningitis, then you have to use what? We have to use intravenous cefotaxime. You have to use intravenous cefotaxime. The what? Third generation cephalosporin. Okay, third generation cephalosporin. So this is the treatment. As far as the treatment is concerned, we have to use what I have already said. That we have to start the broad spectrum antibiotic therapy. Okay, in these cases we have to use the intravenous ampicillin plus gentamicin. But if we see that the chances for having the meningitis, then in this case we have to use cefotaxime. Okay, this is the third generation cephalosporin. This is the third generation cephalosporin. So this is all about the neonatal sepsis in terms of the diagnosis, treatment, and the different types of the sorts of organisms and their classifications is concerned. Okay. So if you think this video is helpful for you guys, please do like and subscribe my channels, and we just do the supporting for you. Okay, that's the thing. And see you in the next video with the new lectures. Okay. Thanks for watching.